Okay, today I share this afternoon. I share clinical application of a psychopuncture train combined with the upper point of a motor zone in treating CFS, so chronic fatigue or chronic fatigue syndrome. So, what is a chronic fatigue or chronic fatigue syndrome? There's not exactly a concept for the chronic fatigue syndrome, and the reasons are known. But clinically, chronic fatigue is very common for 25 percentage people. They have a chronic fatigue, and chronic fatigue syndrome will get worse. About 0.5 percentage people have a chronic uh, fatigue syndrome. But today I'm talking about both because there are no clear boundary between them actually. Yeah, chronic fatigue. Okay, chronic fatigue. This is my concept. Chronic fatigue is a short-term condition that can partly affect the ordinary life of the patient. The most common symptom is needed tiredness. The cause is unknown. In West medicine, in Chinese medicine, it's clear. Uh, Chronic fatigue. There are some symptoms. Here's more talking about Chinese medicine, talking about the spleen Qi deficiency. The symptoms get tired, very easy to get tired. For example, wake up in the morning, they feel quite refreshed, feel quite good. Maybe just working for a couple hours, or after the lunchtime, they feel tired. They need a nap, they need a rest, and then in the afternoon, get refreshed again, energetic again. And without rest, without nap, in the afternoon, they can have blood pressure. They can have a fever, afternoon fever, headache. But this is for serious condition, sinking of the spleen qi or sinking of the middle qi. So Chinese medicine, this one, in a word, easy to get tired, easy to get tired. Yeah, this is the chronic fatigue syndrome. It's a long-term condition that can affect different parts of the body. The most common symptom is extremely tiredness. The cause is unknown. This is from the NHS website. CFS can affect anybody, including children. For the CFS, the symptoms are mainly four main symptoms. Extremely tired, problems with sleeping. They have problems sleeping, and also after sleep, this kind of tiredness cannot get released. I mean, always feel tired. The problem is the thinking, memory, and concentration. So part of the symptoms called after the COVID-19 called brain fog. Dr. Wang mentioned it. Also, exertional malaise means after exercise, after activity, get much worse. So for the chronic disease in Chinese medicine, we still go back to six meridian methods. In the fourth level, this sleep deficiency actually. People very easy to get tired. We call it unique symptom. What is called unique symptom? Just one symptom you can evaluate which level you suffer from. Very easy to get tired in the early morning, very energetic, just working for a couple of hours, they get very tired. After nap, after rest, they get much better, refreshed again. So spleen qi deficiency. In this level called kidney deficiency. So easy to not easy, always feel tired. Maybe just wake up in the early morning, tired, working tired, all tired. But we have to be careful. Not only these two types. in the chronic fatigue, including depression. Depression is still very easy to get tired or always tired. The treatment is different because when we see patients, there are three levels: spiritual level, there's anxiety, depression, easy to get angry, the spiritual level, and functional level, and the physical level. So the depression is a spiritual level. The treatment is a little bit different. Today I'm mainly talking about sleep deficiency and kidney level. Easy to get tired and always feel tired. So the feature of the brain, So brain is very special. It consumes 20% energy with 2% weight. That's why we say all the young meridians go to the head. I mean, it is always burning, always burning. Okay, so spleen deficiency. Spleen deficiency is talking about the qi sinking of the middle qi. Yeah. So if you want to differentiate, there's we take the pulse. We take pulse. When we take the pulse, it's more on the left side. On the left side. So the pulse is a short. So it means sinking qi. But if the pulse go to the major theta, it's called it's long. So one is rising up the liver yang, the other one called sinking the qi. Yeah, just taking the pulse. So how Chinese medicine treat the spleen qi deficiency? We have to understand this theory. You can see here it's called flag. This is called flag. In the middle, don't forget there's a flag. The tumor in the middle, all the way from the lowest part of the body chunk, go all the way up to the back wing. So for the spleen qi deficiency, upper point of the motor zone, yeah, in the scalp acupuncture, upper point of the motor zone, 百会 is very helpful. Only this point helps. Only this point helps for the spleen qi deficiency. For example, if you're sitting here, maybe one of you have a spleen qi deficiency. I'm the typical case. Easy to get tired. You just press the point. You press it. Use tools or use your fingers. If you're tired and press it, your energy go up. You can release the symptom. But the upper point of the motor zone, say 220, or more or less the same point. Am I right, Dr. Wang? It's almost the same, right? Upper point of the motor zone. It's very closely. I cannot say exactly, on the same area, but very close to each other. So we just say 220. Okay. So why is it helpful? We choose other one because it cannot last long. It's helpful. The next day, you attend another meeting, you still get tired again because the reason, the background is a spleen qi deficiency. So the energy cannot go up to the brain. So that's quite interesting part because in Chinese medicine, we talk spleen qi deficiency. But in Western medicine, they say lack of the blood flow to the brain, right? So why there's a difference? Because in Western medicine, they're talking about the result. Chinese medicine talking about the reason, no different. Okay, so lack of the because of the energy, the qi is energy. The qi bring the blood to the brain. Yeah, so Chinese medicine talking about the reason. Yeah, we deal with the reason. So, but how to deal with the trauma? First one is the 220. It's very helpful. But the reason is the background information is a spleen qi deficiency. We have to tonify the spleen. I think all of you know, if you want to tonify the spleen, I think you can recall some points like Pishu, right? Letter 20. Pishu, always say, okay, cover like Sudan Li, some points, right? But if you want to make the effectiveness stronger, we need we call tactical deployment. Okay, because we have to understand, the 充满 in the middle. For example, like two peaks of the human hormone secretion are like heights. One in the morning, 8 o'clock or 9. We have a peak time for the hormone, and we are quite energetic. So 8 o'clock or 9 o'clock is a very good time to make concentration to study. And in the afternoon, there's another peak time that's like 2 o'clock. Yeah, we still feel quite energetic. There's another peak time for the hormone uh, production. So just like the type, up and down, up and down. So this is very useful. This is very useful. For example, sometimes the tumor, give example. So sometimes the nose blockage. Yeah. Sometimes the reason is a spleen deficiency. Yeah, we choose some points that can release. We mentioned the tie-in, right? The hand tie-in, the foot tie-in, they are all called tie-in. So we probably not choose points from the lung meridian. We can choose the spleen meridian to release the symptom of the nose. That's quite helpful. And also eye, some people have a spleen deficiency. They have a discharge from the eye, white discharge. This is still called spleen qi deficiency. And if you dry eye, yeah, we still can choose some points, release the symptom. Yeah, if the qi cannot rising up to 百会, we choose 百会. It's very helpful. And another point is a 至阳. A 至阳 is a do nine. It's a special point. So this point is from yin to yang. This point just like the gate. A special point. It's a special point for spleen system. Another use, people have a stomach spleen deficiency. We can use maxa. Or people have a emergency. People they have a stomach cramp, very painful and vomiting. So massage is better than acupuncture. Just you can use your elbows, use your knuckles to hard press the point, as it can release the spasm of the stomach. 治疗. For spleen deficiency, maxa with needling. And below do 9 point is spleen 20. I think everybody knows this one can treat the spleen qi deficiency. But below bladder 20, 脾腧 is the stomach 34. 梁丘. Yeah, 梁丘 on the legs, right? 梁丘 is another point to treat the spleen qi deficiency. So what is a 梁丘? 梁 means the beam of the roof, one part of the roof. So 梁 is very helpful for the building. If the 梁, something's wrong with the 梁, the roof will collapse. So in Chinese medicine, so 梁丘 just like the beam of the roof. So if people have a spleen qi deficiency, the 梁 clap, the qi will get sack. And also, people have a spleen qi deficiency. If you press the point on the 梁丘, you can find like a rope, like knots on the spleen 34. Below 梁丘 is the stomach 41. 41 in Wusai acupuncture training called the releasing point. What's the meaning of the releasing point? Because the 解析 means release or untie. So when the qi, the 冲脉 go up from the lower part of the body and then go to the brain, there is a gate. It's a neck. It's a neck. So when 解析 is blockage, it means that here's the blockage. The qi is not easy to move out to the brain. Because, for example, like one type of cervical spondylopathy is a spleen qi deficiency. This point can release because the energy comes out from the tube and then to the brain, the 冲脉, right? If something's wrong with the gate, yeah, we choose 解析 can treat the cervical spondylopathy as spleen T deficiency type. And then 线骨, stomach 43 and large intestine 4. What we choose, the first one, we choose the stomach 43 because you can see 线骨 is a sunken, dented. 合谷 is prominent. So also it is in the Yangming, it's more axis. But 线骨 is more deficiency. So sinking, that's sinking of the spleen qi. So it's quite special points to treat spleen qi deficiency, the sinking of spleen qi. It's quite helpful. If people have a spleen qi deficiency, you just use your fingers sliding up and down on this point. You can find it's very, very tender. It's quite tender points for this spleen qi deficiency. Yeah, that is for the spleen qi deficiency. Type chronic fatigue, and this is for the CFS kidney deficiency because it gets worse. Because we mentioned the 太阳、少阳、阳明、太阴、少阴. After the 少阴 is after 太阴is 少阴. So when people have a spleen qi deficiency and gradually, finally, they will get worse. It will go to the next step. It's a kidney deficiency actually. So if you get worse, chronic fatigue syndrome, we tonify the kidney actually. Yeah, we choose Kansanzhen. So it is on the these three needles. Here in hand acupuncture represent the kidney. There is another hand technique called burning the small dragon mountain. It's about the kidney deficiency. People feel tired, and also for the typical kidney yang deficiency, they also feel quite cold. The bodies feel quite cold because of energy hormone issues. People feel quite cold. We like to use this hand technique. So it's quite clear if you walk road after taking the needle, you get sweated. The sweat. Because our energy from the shao in from kidney, and then it will go outwards to taiyang level, and people get sweated. And some people can feel quite hot. Some people just feel local, get sweated, and this area feel quite hot. Some people can feel the whole body feel hot, but some people feel cold. Some people feel cold on the hand because they have internal cold. So people will feel cold. But after feeling cold, and after dispersing the cold, and then they can feel quite warm. But does it help? Yeah. Yes and not. Yes and not, because it depends how serious the kidney deficiency. Yeah, if it's quite serious deficiency, we have to find the root. It's here. We call the kidney nest. Kidney nest is these 4 points: kidney 3, kidney 4, kidney 5, kidney 6. We call kidney nest. Well, we know kidney 3 can tonify the kidney, right? But if you're herbalist, a herbal practitioner, we never use one herb, right? Because one herb is not strong. So if for the quite serious kidney deficiency, we like to choose these 4 points together. And in Wu's acupuncture training, we call potion field, just like the eye of a tornado. It's like the eye of the water is running around in the middle. So the middle eye, the eye in the middle is they have a strong energy. So we like to use all 4 acupoints. And for kidney yang deficiency, needles with the mouth suction is very helpful for the kidney yang deficiency. So how do we know is it get effectiveness or not? So you can use in the mouth suction to move up here, and finally you can do the whole feet get warm, just like soaking in the hot water. Yeah, that means it's working. But if you take, the matza, finally, the people, 5 minutes, right? 5 minutes stop matza. Finally, maybe the patient cannot feel anything because it's not strong. Yeah, we like to use it in the matza. Also, if possible, we have uh, 雷火灸, right? The very thick one. You don't need to mask every point. Just use, the 雷火灸to mask all the points. And finally, if you local area, the feet were warm. That's a very good one to tonify the kidney. Might be working, might be not. Why? It depends how serious. Because sometimes, if you tonify here, it's working, but for some patients still not working, might be the problem is still kidney deficiency, but a kidney essence deficiency. Yeah, kidney essence deficiency, we have to use the herbs to tonify. Because the 伤寒论, right? 伤寒杂病论, so two books, 伤寒论 and 金匮要略. So 伤寒论 more for the functional problem. Yeah, 金匮要略 more for the the physical the body get affected. So that means symptoms get worse. The physical body get affected. We need to tonify the body. We need to tonify the body. That will make it more effective. After tonify the kidney, does it work? Yes and no, because we have to understand. Yeah, that's Chinese medicine. Because might be the people suffer from depression. In the chronic fatigue symptom, we say, okay, some patients, I treat many patients, but some patients are very, very difficult to treat because we have to understand it is depression. Patients suffer from depression. How do we know people suffer from depression? Even in Western medicine, the doctor, they need to ask the patient to fill in the form, like a questionnaire, to fill in the form. I think it's SDS form. So after filling the form, is it slightly depression, medium depression, or serious depression? Yeah. So for depression in Chinese medicine is more for the second level, 少阳 or 厥阴. Yeah, 少阳 level, qi stagnation. Yeah, even the qi stagnation, we have to treat the depression, and then people can feel better. Otherwise, still you tonify the kidney, you tonify the spleen, but still not working. Why? Dr. Shi is a liar. But depression. So more and more people suffer from mental problem, like Dr. Wang mentioned. Yeah. So depression, if you can make diagnosis, treat the depression, and the symptoms will get better. How do we know the people suffer from depression? In a simple way. There's a simple way we call unique symptom. So you ask the patient, kidney deficiency. Patient will say, "Are you easy to get tired?" She said, "Always feel tired." This is very likely it's a kidney deficiency. If people say very easy to get tired, after nap, rest, I get better, it's very likely spleen deficiency. But some people tell you, early morning, no, I feel very tired. But what about your symptoms in the evening? He said, this in the evening is better. So this is very likely is a mental problem because of morning worse, evening better. But normally, because we're working the whole day, right? Should be morning quite refreshed. At the end of the day, we feel tired. But depression is a little bit different. And then it is not diagnosis. And then you ask the patient to fill in the form. Yeah, you guess probably suffer from mental problem because she is stagnated. Okay, so I do a little bit summary. Spleen deficiency, yeah, chronic fatigue. For the chronic fatigue syndrome, very likely it's a kidney deficiency, but maybe not working with the treatment I introduced. Maybe she suffer from or he suffer from depression. So we have to deal with a spiritual level to deal with a liver system. It's a liver dominating the emotion. Okay, so that's it. Thank you. So, which point? I mean, which point? Because different. On the hand, the side one or the here, or the side one. The side one it depends which one. I like the here. We choose this one. 绕着前股，后续是万股，阳股，阳股，阳股 is four, right? Small intestine four, five. Yanggu. So Yanggu and the Wangu, we use at least one sun. So because we inserting and towards in this area, we tonify the kidney. We have use a little bit longer one, but here we can use a short one. Here we can use 1.5 sun. But this one, Hoxi, small intestine 3, we can use one sun towards towards here. Because this meridian in Wu acupuncture we say shared meridian. Here is Shao Yin meridian and Shao Yang meridian together. Superficial is Shao Yang, is Shao Yin. Deep is Shao Yang. So they share the meridian. So if you take a needle from here towards the Shao Yang meridians to release the symptom liver T stagnation. But more this one, Mango as multi-purpose, for Wangu. It's not painful. I don't think it's painful. Okay, so thanks, Dr. Ibrahim, for the unique and very enlightening information with us. And this is something to thanks you. Okay. Thanks so much indeed. Thank you. Thank you. Good. Thank you. Thank you. Thank you. Yeah. Thank you, Cecilia. Thank you. So the next speaker, I would like to pass the time to my lovely colleague and Dr. John. Pleasure to meet you. Hello, everyone. Down here, I think this is all I mean, companies. Really, I'm the one. Yeah. That's what oh my God. This is smart work.那谁主持呢？面有事，那你就直接说吧，就但是我有没办呢？算了吧，你就不要了，你就直接说。是不来主持。是我你来主持那个。Yes. Okay, next to present is Michael Wang. Michael began his TCM training under Professor Enqin Zhang, contributing to Zhang's Shanghai study guide, and later became one of the Professor Tianjun Wang, first graduates at UEL. She has trained in Nanjing, Beijing, and Shanghai. Holds a BSc in physics from Imperial College, and now practice on Holly Street. So now let's welcome Michael Wang.
Hey, so my brain's fried, which is very appropriate. I'm going to try and keep this case study as short as possible so you can all get home. So, anyway, so can scalp acupuncture treat blindness caused by a stroke? So, imagine if you just woke up one day and you can't see at all. So this is what happened to one of my patients 2.5 years ago. Um, the interesting thing about this case study is that blindness in both eyes after a stroke is really rare. All of the stroke patients that I treated so far have been for hemiplegia or difficulty um, speaking. About 80% of all stroke survivors have paralysis of some form. Approximately 65% have some sort of visual impairment, but usually in only one eye. For blindness in both eyes to actually occur, it's actually quite a serious event. It actually needs the stroke to affect both sides of the occipital lobe. So, sorry. So my patient is a 62-year-old male, and it started in July 2022. The first red flag was when he went home and left his shopping at the supermarket. He just wasn't feeling very well. He had a really intense headache. It was so painful. The painkillers didn't help. His wife took one look at him and said, "You need to get to the hospital. You don't look well." When he went to the hospital, they didn't quite understand what was going on. They did an MRI and said he didn't have a stroke. Uh, his blood pressure was about 180 over 120. It was quite dangerous. So they put him on some medication. They put him on blood thinners and admitted him. The next day he woke up and he couldn't see. He described it like looking out into a deep sea of fog. He said if he stared out the window, he thought he could make out the outline of some buildings, but it might have been in his imagination. So he was feeling quite scared, um, quite lost, pretty depressed. And the doctors didn't know what was going on. They eventually they did a CT and confirmed, yes, we think you had a stroke. There was infarction in the area that was affecting his balance and also his eyesight. So they told him that he was going to have difficulty balancing and walking, and he got up. They told him to try and stand on one leg, and they were really surprised because he could stand on one leg. And to this day, his balance hasn't been affected. However, that part of the brain, which is responsible for balance, the brain cells, some of it's actually died, as well as in the visual cortex. When I actually read the CT report, I was actually quite surprised of how much damage had been caused to his brain. Several of the arteries were either almost blocked or completely blocked, including the posterior inferior cerebellar artery and the anterior inferior cerebellar artery. There was a lot of plaque there. When I started the consultation, he told me he thought he may have had a stroke 2 years ago. So that suggests he had a TIA. One part of his body, one half of his body was affected. He had problems speaking. So this is of a conventional stroke. And he was suffering from severe hypertension there as well. The doctors at Moorfield said that only about 1% or 2% of stroke survivors actually lose eyesight in both eyes. That's how rare it was. Okay, so, okay. Yeah, another complication was that he seemed to be having mini strokes or what I would call strokes every single day. So about once a day, he said he would just completely space out and then he'll lose some sensation just above his mouth. So this is quite serious as well. And when I first started the treatment, he didn't want any Chinese herbal medicine. After about 3 months, I prescribed him some Chinese herbal medicine, and luckily those mini attacks actually stopped. Um, he It took 6 months before I actually saw him. he had an acupuncturist. Uh, he asked about what he could do, and he said you should try scalp acupuncture, but I'm not trained in it. So he asked a friend, and then I got a referral, and then I went to his home. And when I did the consultation, part of his eyesight had come back. He was still blind, but everything was blurry. He couldn't make a cup of tea because he didn't know where he was pouring the water. His father came to the door to answer because in the house that he lives in, the downstairs, his father lives, the upstairs, he lives, but he couldn't actually come downstairs. He couldn't see. Okay, so he was getting regular headaches, taking painkillers every day, dizziness, brain fog. So he wasn't in a particularly good place at all. So my TCM diagnosis was liver wind. That was obvious due to the hypertension, and also stagnation of blood and phlegm because of all the plaque that was in the arteries of the brain. So the treatment plan was that I was going to try to regenerate the cells in the visual cortex, the visual area. But then later on, I added the balance area as well. And I'll talk about that in a second. And also, I wanted him to go on Chinese herbal medicine. So I had to modify CAHMA Gotenyin with some herbs to actually try and unblock the arteries and improve blood flow to the brain. Because if you do scalp acupuncture and you're trying to stimulate that part of the brain, you want blood to get to that area. But if the blood can't get to that area, it's not going to be as effective. Okay. So initially, the treatment was 1 session per week. After a year, because of financial considerations, we cut it down to once every 2 weeks. But he's still actually on Chinese herbal medicine still. So, uh, did this work? What sort of effect did it have? Oh, actually, let's talk about the points first. So, in this scenario, actually, just backtracking, while he was at hospital, an ophthalmologist examined his eyes and told him there was actually nothing wrong with his eyes at all. There was a little bit of cataracts, not yeah, cataracts, but it was actually commensurate with age. There was actually nothing wrong with his eyes. It was all neurological. So I've added some TCM points here, but I think that the most important points are the points for the brain. So that would be the visual area, the balance area, and it should be there's D16. You probably noticed I put the nose, throat, mouth, tongue area. That's because he was taking clopidogrel, which is like a blood thinner, and he actually lost his sense of taste because of that. So I added that there, and accidentally cured his snoring as well. So I didn't know about this until apparently his wife told him, "Yeah, you stopped snoring since you had acupuncture." So that's how I discovered that point actually works for that. The spirit emotional area, that I added later because at the beginning, um, although he was used to acupuncture, there was quite a lot of needles that I was using, and I just wanted to ease him in slowly. And I didn't want to put too many points on his head. And I didn't actually use electro until after a few weeks. And the spirit emotion area I just added later on because he was just feeling so down. He was arguing with his wife, he was complaining a lot. Sometimes when he complained about the cost of the acupuncture, and then he stopped complaining since I added that. So that's a tip for everyone. So anyway, the TCM points I think are less important in this situation because it's the brain that you're treating. Um, however, he had a lot of photosensitivity. And I think the combination of small intestine 6 and gallbladder 37 is helpful for that, combined with liver 3 as well. So I've put down some of the reasons why I've done these points, but they actually work well quite together. So, for example, yeah, the points on the neck like go by the 20. I learned in Nanjing that actually dilates blood vessels. So not only does it expel wind, but it will increase blood flow to the neck. Bladder 10 for similar reasons. D16 with Dao Qi also improved his mood and also directed the treatment towards the brain. So, okay, that seems all clear. I think. Right, so after 2 sessions, he reported an improvement in his eyesight. He asked me, first of all, can you cure this? And I said, I really don't think I can answer that. He wanted to know how long it was going to take. I said it's really difficult to tell, and it's a case by case basis. But I was still a little bit surprised that after 1 session, his actually eyesight improved. So what he said was his sight actually got worse, it went blurry. Then suddenly it started to clear up a bit. Unfortunately, this didn't last. But over the next few weeks of treatment, I introduced electro on the visual area. And then later on, I also included electro on the balance area. He said that sometimes he'd be watching TV and then it would suddenly things will come into focus and it'd be clear. But again, it didn't actually last too long. And this will happen maybe about once, maybe twice a week. So his vision would improve and then go back to the way it was. As his eyesight improved, we noticed that he had a lot of photosensitivity. So if he actually looked at bright lights, it can actually trigger a headache quite quickly, and of course dizziness. He also had problems identifying colors. So he knew that his carpet was a deep red, it was a burgundy, but it actually looked bright red to him. There was a charging cable he had, which was orange. He knew it was orange, but it actually looked pink. After a few months, the colors returned back to normal. But at the beginning, he just found it quite confusing. Um, so I put some milestones on the right. Like the day he told me he could use the calculator on his phone. We knew that was significant. And then almost a see, yeah, about 10 months into the treatment, he used public transport for the first time. So he wouldn't register as blind. He was on some benefits because he wasn't working anymore, but he didn't want to register blind in case they took his driving license away. But he went to the doctor's surgery. He just got on the bus by himself. Probably about 2 months after that, he used the tube for the first time, but not in rush hour. This is too many people. Um, and you probably can't see down there, but just recently in my last visit, he said that. So I'm seeing him about once every 2 weeks now. He said that the week before, for 2 days, his vision seemed really clear, but only for about an hour or two, and then it will get blurry again. So he also has a condition now where part of his peripheral vision is actually gone. So he said that if he rests his hand on his knee and he moves his hand, he can't actually see it at all. Um, so there's also just parts of his vision that are missing. The other thing is that there's some issues with cognition. So sometimes he can see letters or words, but they don't have much meaning for him. So if his eyesight does return, and the goal is to get it good enough so he can go back to work, that I may have to treat him for some acupuncture treatment just so that he can actually recognize the meaning of words as well. Okay, so that's my patient on the right. Okay, yeah, so does this actually work? Can you actually cure blindness? Well, I'm still treating him, so I can't answer that just yet. And the other thing is that this is just one case study. And because this is so rare, I don't know whether I'm going to get another case study like this again in the future. But yeah, I mean, it's looking quite promising at the moment. And yeah, I'm quite optimistic actually. So, and if anyone else has treated a patient that has actually gone blind, I'd be very interested in talking to you about this. Okay, so yeah, I think we've got time for questions. Yeah.
You mentioned regeneration of cells.
Yeah.
I think about the health thinking more. Can you do that? So yeah,
Yeah, sure. This is hypothetical. So there's a theory that another part of the brain will actually take over a function if you lose. But I'm not really treating another part of the brain. And I do believe that, like with the herbal medicine, for example, it'll take a while because there's a lot of plaque there that you cannot unblock the arteries. And he's been on herbal medicine for about a year and a half now. So I think, there's been signs that it's actually working. To regenerate brain cells, well, I don't know, to be honest. I told him that was the goal. And there have been studies, I believe, where nerve cells which have died have been regenerated due to acupuncture. So
any literature?
on PubMed, I mean, I did a search for treating blindness with acupuncture on PubMed. I couldn't find anything. There were actually studies about treating eyesight, but actually complete blindness due to stroke. I couldn't find anything. There might be something.
Okay, so I'm not really asking questions, but however, what I was giving my some feelings about how to move on further.
Yeah. Okay.
According to my theory, I would say if people have suffering of both sides, it's usually it's an involvement of the chi difference with damp and gland. Or blood stasis, obviously.
Yeah.
So in your treatment, a herbal formula, have you considered to use like chi tonic? And then have you tried?
There's a chi tonic in there.
There's a chi
Yeah.
tonic, yeah.
Dansheng.
Yeah.
Yeah.
Well, the best chi
thank you.
tonic will be 益气聪明汤. So if you could try to use 益气聪明汤 plus phlegm dissolving and the blood stasis moving,
Okay.
it might be working better than the Timatotan, because I think
Yeah.
the early stage is past.
Yeah, that's true. I'm going to get that from you because the early stage it was critical. We had to stop him getting from strokes.
Yeah. So then later on, what you said is his vision get improved. However, it doesn't last long, and when he's tired, like 1 2 hours a drop. Usually, the signs of like deficiency, like if he either using too much chi or blood, use out, then that starts to get weakened.
Okay.
So I think that
I'll speak to you after. Thanks.
I first of all, thank you for your detailed case study based on your preview strategies and use of scavenger and general perhaps that's a great success case. Continually, I believe you can become better. But I'd like to add something on your question about the neural regeneration question. It is true. There are many research that indicate in the last 20 years the brain has we call neuroplasticity. So that means the brain cells from very classically neurological logic, the brain cells not that. It's no second life, but now more research based on really first and research. The brain cells has the ability for regeneration or plasticity. So that's why so many neurological cases, after a couple of weeks, months, even years, they still getting improving better for the blindness, for the paralysis, for the speech problem, hearing problem. There are more and more cases. If you continue this kind of rehab action on the scabies culture, that is, we say a theory about that. That's background. That's background. Why? Economical energy can improve and better for this kind of blindness. That there are, if you're interested, you can make a further for insight. I'd like to share some research as well on this. All right. Thank you. Thank you very much.
Yeah, you're welcome.
Any more questions? No more questions? Yes. Okay.
That could be 50.
Five or more. Same. That's just for you. Thank you very much. Thank you.
We all doing everybody busy, and that we very good job. But I would say we have all of these annual conference. I believe everyone has a wonderful time and we got a study, we have a knowledge and now we can see the next to our chairman, Professor Wang, chairman of the AIT. I'll see you again next year. Thank you.
Thank you, our General Secretary of the CAHMA. So now it's time to conclusion. Invited by the President of the New Year, I'd like to here to say something before we. So thank you all our colleagues, our students, our colleagues, our Chinese colleagues, and the Western colleagues together, together in the same group to share our experience, to say hello for everyone. So that is the unique area, not only academic exchange, but also friendship, but also the sense of community. So we have lots of online courses, conference, seminars, but never replace for this in-person conference. Many of colleagues will say, oh, we know you many years, never seen you in person. So we always encourage our more community engagement for friendship, for colleague, for academic, and for our reduced aging. Great education. I've done that. Great. Yeah, okay. So you know what? All our council members. I thank you for our mayor, our mayor, our teacher, for our many years. He's like sitting on the corner to read session and the whole day. Thank you very much. Our other colleagues to member colleagues to join today to look after everyone, such as our Dr. Haina, Dr. Shin and our member, Dr. Hui Hu, and let's say Dr. Ye, Yu Rong, and Dao Xin, and all the to be our families. That's our employer. We take the same breath. Okay, so thank you very much for everybody here. The next time, it's something like a trial, a test. So what we together with CAHMA and ASA. So I think I personally believe it a successful trial. So in the future, we may do something similar to see it together. In which although we say today that all our English in speech, but I believe it's up to our Chinese colleagues, Western colleagues to work together and also to training, to practice, to improve our English language and academic speech as well. Great. Yes. Thank you very much for everybody for the us. Hope to see you all again, maybe next time next year. Goodbye.
I'm one weekend, 20 pounds.
Oh,
Yeah.